2,400 new cases today, nearly 67,000 people now affected worldwide. Also, 139 new deaths, pushing the total above 1,500. This video just in from Wuhan, a new hospital under construction there. And the picture all of China is celebrating tonight. An entire family stricken with the virus, rushed to the hospital 14 days ago, has recovered. The parents and the baby released today. Now, Meg Terrell with new news and fears tonight from the medical community on how easy this illness may be to spread. It's fascinating stuff, Meg.
It really is, Tyler. So researchers, of course, are trying to define just how infectious the novel coronavirus is. And the public health term for that measure is R0. And the current estimate for COVID-19 is between 2 and 3, meaning every case may, on average, infect 2 to 3 more people. Now, that's more than the seasonal flu and the 1918 flu even, but less than SARS and much less than measles. A new estimate, though, from researchers at Los Alamos National Lab suggests the value for COVID-19 may be closer to 5 or 6. However, we should note that study has not been through the peer review process, meaning the findings are preliminary. And with us tonight from Washington, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease. Dr. Fauci, thank you so much for joining us tonight. And as the information in the picture is evolving so quickly, what can you tell us about what you've seen about the infectiousness of COVID-19?
Well, it's certainly quite infectious in its ability to go from human to human in what we call sustained transmission. It is about a 2% mortality by official determination. But since there are so many people who have mild disease, either asymptomatic or minimally symptomatic, the denominator of that figure is probably much larger. So it is not nearly as deadly, as it were, as SARS is, which had a mortality of 9 to 10%, and the Middle East respiratory syndrome, another coronavirus, had a mortality of 36%. Seasonal flu, in comparison, is 0.1 or 0.2% at the most.
And we know that it spreads by close contact, respiratory droplets. Some talk of it spreading if you touch a surface where the virus may be. Some people are wondering, could there be airborne spread of this virus? What have you seen?
Well, certainly there could be. It would be unusual if it was just aerosol, but that is certainly possible. When we had the SARS epidemic back in 2002, 2003, there were individual episodes of what looked like it could be airborne, but there's no definitive evidence right now that it can actually stay in the air for a long period of time. I mean, when you have a respiratory droplet that goes from one person's cough to another person, technically that's airborne for the droplet. But when people talk about airborne in the precise sense, they mean that the virus can actually stay in the air for a considerable period of time.
I want to ask you also about work on a vaccine. You said last week that if all goes well, no hiccups, 2.5 months to starting human clinical trials. That is lightning speed. Are things still going that quickly? And then what's the timeline after that?
Yes, things are going that quickly. We're right on time to be able to start what we call a phase 1 trial to determine safety and whether it induces the kind of response that you would hope would be protective. That's done in a limited number of people, 20, 30 or so people. After about 3 months after that, which would bring us to the 6-month mark, we would know the answer to that. But then the real work starts, because then you start a phase 2 trial, which is to determine if it actually works. And that would involve hundreds, if not a couple of thousand people. And that would have to be done in an area where there are infections. That would take an additional 6 to 8 months. So even though, as you correctly said, this is rocket speed to get into a trial, we still, under the best of circumstances, won't have a vaccine that's deployable for at least a year and likely a year and a half. So right now, the answer to containment is public health measures, identification, isolation, and contact tracing.
Well, and we're just about out of time, but we understand the U.S. is about to start surveillance in 5 cities using your flu surveillance system.
Right.
Do you believe that we're going to see cases that we just hadn't captured yet, that we already have some here in the community?
You know, we don't know. I can't predict. I don't think there are, or at least not many, but we want to be doubly sure. We want to be sure we're not missing any, because right now, of the 15 individuals, they are in isolation. 13 of them were travel cases from Wuhan, and 2 were close contacts. We're tracing their contacts, but we want to make sure people didn't come in under the radar screen, and that's the reason why we're having the 5-city screening of people who present with influenza-like syndrome, but who don't have influenza.